Dr. Rakesh, as Doctor mentioned about a couple of treatments that Aster offers, I want you to highlight those treatments for us, please.
Hello, I'm Dr. Rakesh Sinha. I'm a laparoscopic bariatric surgeon at Aster Royal Hospital. So we are doing here different types of procedures. So that depends upon what type of patient we have. So we evaluate the patient right from beginning, what is his diet and what are his comorbidities, and then we fit in the surgery into that condition. So basically, if you ask about surgery, there is one restrictive type surgery and one is bypass type of surgery. So mainly, most common operation what is done is sleeve gastrectomy. And those who are borderline obese patients, in those we offer some balloon also and some injection treatments also, what already my friend Dr. Sebastis has talked about. So coming to the surgery part, what we do a sleeve gastrectomy in which we remove 70 to 80% of the stomach so that the patient can eat less and they reduce weight. So it depends upon how much big is the stomach. Sometimes we have to remove 80%, 90% also, depending upon the size. The other type of surgery is bypass, in which we make a smaller pouch of the stomach and we bypass the initial part of the small intestine and bring the ileum and join it with the topmost part in the stomach, so that the food doesn't go into the stomach, duodenum and the jejunum. It directly goes into the ileum, and directly the food we keep the intestines, which much is required for the body. So body requires nutrients, so we keep that much of intestine which is good for the health of the patient. Accordingly, we decide what type of surgery we have. So now in bariatric surgery, we have more than 15-20 types of surgery, which we decide after taking the history of the patient, how is his eating habit. If somebody who is voracious eater, we cannot do a sleeve surgery for them. They will fail the surgery because they will eat more and then sleeve can get dilated. Many of the patients who comes with conditions like GERD, gastroesophageal reflux disease, and if we do a sleeve surgery, it is a high pressure system, so it can cause more reflux. So we need to choose the surgery according to the patient and his conditions. Somebody who is coming with a lot of comorbidities, they have diabetes, they have hypertension, they have sleep apnea, they have osteoarthritis, and their BMI is more than 50, 60. In these patients, if we do sleeve, it will be insufficient for the patient. So patient may lose some weight, but later on they can regain weight. Because of that, they cannot have comorbidity resolution also. So we need to choose accurate surgery. Here in Aster, we have a protocol. We evaluate the patient pre-operatively. We send the patient to the dietitian for evaluation of the diet. We send the patient to endocrinologist to see for the diabetes part, the hypertension part. We evaluate cardiology part. We evaluate the pulmonary part, everything. Then the patient is considered for surgery. And then we decide which type of surgery is good for the patient, and then we select the surgery.
So doctor, you spoke about patients being pre-prepared through the whole test and through, of course, diet and other process. I want to know, while during the surgery, when you realize that we didn't get the expected results, do you usually go for a second surgery, and is it like or change the treatment in the meantime or during the process, and how often does that happen, and what is the timeline between them?
Yeah, this is a very nice question what you have asked. See, most of the patient thinks that we have gone to a surgeon and we have done the surgery and that's it. Now it will be a miracle and then he will lose weight. But see, the surgery also depends upon the patient factor. If the patient is eating too much, that can lead to weight regain after surgery. So we have graded approach for those patients also. First, we put them on diet, and even if they are not losing weight, we sometimes try the hormonal treatment. Even if that is not working, then we go for second surgery also. We have surgeries which can increase the weight loss in already. If somebody has undergone sleeve surgery, restrictive surgery, we can change it into bypass, which can lead to more weight loss, and they can achieve their target by the surgery again.
And what about patients who already have some preconditions, health conditions, especially?
Yeah, definitely. So we need to choose the surgery according to the patient's health conditions. Like if the patient has diabetes, and if we do a sleeve surgery, it may not be beneficial for them. They will lose weight. They may have little regression in diabetes, but they may come back again. So if we do bypass surgery in these patients, the chances of we have internal insulin secretion, that is called incretin hormones, are increased, and that leads to endogenous insulin secretion from our existing pancreas. So we have a system here in which we can assess pre-operatively also by doing a C-peptide test, by doing a GAD antibody test, and then we find out whether after the surgery the patient's diabetes will get resolution or not. So nowadays we are not doing surgery only for obese patients. Those patients who are having only diabetes, we can offer this surgery for remission of diabetes. In few patients, more than 80 to 90%, we have a record that we can have remission of diabetes after having a bypass surgery.
So doctor, I have two interesting questions for you. Suppose say a patient has been very, very healthy, okay, a very interesting individual who's got a great lifestyle, and say all of a sudden post 40, 45, you see signs of obesity and he wants to come, or he or she wants to come for treatment. I want to understand, have you ever met patients like that, and two, what do you think are the causes of all of a sudden symptoms or signs of obesity showing in them?
Definitely, it is a nice question. So, see, many of the patients, those who are coming, those who are healthy for last 30, 40 years, and they are maintaining their lifestyle good, but they change their lifestyle after 45. Sometimes they start eating more, the calorie intake is more. They may be eating less, but the sweet category is more. So if they are eating more sweets, first we give them a diet counseling. We try on diet, and even if the patient doesn't lose weight, then we can offer them a bariatric surgery. Yeah, regarding your second question, what you had asked, those patients who are coming after surgery and they are having weight regain, first we send them to our dietitian here. So I think she will be better answering your question, how to modify the diet and all. I think over to my dietitian.
Okay, I'm going to end with another very simple question. Is it true that post 30 or 35, it is difficult to lose weight, even if you have a healthy lifestyle or follow a diet or a good regime? Is it true that post a certain age, it is difficult to lose weight?
Sometimes there is hormonal changes in females. Post menopause, many of them are gaining weight. That can happen. But in the male patients, most of the sedentary lifestyles, that can lead to weight regain, and these patients can do better with lifestyle changes and diet changes. Here in Aster, we have a complete set of doctors, dietitians, and we are happy to help you for all your needs. Thank you.